Hi, everybody. This is Blueprint by Adam Hurly. I'm Adam Hurly. I'm a grooming journalist for outlets like GQ, Men's Journal, Forbes. I've been on the beat for over a decade now. Blueprint is where I put all of my expertise into one place, as well as my experience. And on the topic of hair transplants, I am talking very directly. Here's me before, here's me after, my partner, here's him before, here's him after. We've got 2 hair transplants under this roof, and in this video I want to talk about what you can expect on the day of the procedure, as well as the week and the month afterwards, leading up to the few months and the year and a half afterwards of regrowth. Let's talk about that whole timeline, including the awkward and the wonderful payoff, okay? Now, this is a 2-part video of sorts. I also published at the same time as this video, one talking about who is a good candidate for hair transplants, who shouldn't even consider it, what to expect in terms of costs, certain red flags to look for, the technologies to use, should you go abroad, should you stay domestic, all sorts of things. So I hope you'll watch that video as well as this one. Let's get into it. One more disclaimer. I'm not a doctor. You should see a doctor. You should see a surgeon. Get tailored advice for your situation. All of this is the most general knowledge that is available on the topic. You do need to see someone specific for what to expect with your hair transplant. Let's start with the pre-procedure. Let's say that you've decided to get a hair transplant. Here's what's going to happen right before. They're going to start by assessing the donor and the recipient area of your head, the donor being the backs and sometimes often the sides, and then the top of the head being the recipient area, the transplant area, okay? This is something you can have done locally if you are traveling far and wide, but if you do travel to a place like Istanbul, they will likely do this stuff with you the day before your hair transplant, and they will already know at that point if you're a good candidate for it, but then this will give them that exact precise number. By assessing these things under a microscope, they're going to understand the general number of grafts that you're going to have relocated from the back to the top. Now, this is going to be determined by the number of hairs growing out of each graft. This can be anywhere from 1 to 5. 5 is really impressive. Not a lot of people are growing 5 hairs from their follicles. A lot of people will be in the 3 to 4 hair average range. Others might be more thin and getting 1 to 2 hairs. It's going to be different for everybody, and that's going to dictate how many grafts that you need to relocate. This is also going to be determined by how much real estate they're needing to cover up top of your head, right? Because if you're only filling in a little bit of recession versus filling in a lot of crown thinning, then that number of grafts is going to change, and it again will be determined by how many hairs are growing from each graft. And then when you show up the next day, they will draw the hairline on you. It's totally optional to shave your head. If you're a guy and you don't mind people knowing that you've had a hair transplant, I'm all in favor of shaving your head. It's very likely they're going to have to shave the back of your head anyway if you're doing the most common method of hair transplantation, the FUE or the DHI, which is very similar. You can learn more about those in the other video. They also don't have to shave the top of your head regardless of the type of transplant you're getting, but if they're shaving this weird patch in the back of your head anyway, it might just make sense to shave it all. It kind of depends on if you're going to expect to be on like Zoom calls for work a week later. I needed the before and after photos for my hair transplant. I think it's kind of a remarkable thing to show off or to have documented. So if you don't mind, I would say just go for the full head shave. I think having the shaved head gives the clinic a much easier time navigating the implantation process, but I'm sure a lot of them would say that it's perfectly fine if you don't shave your head. I leave that to you and the clinic and your personal needs. One really common question I hear from people who want to get hair transplants is regarding the anesthesia that is administered to numb you, to knock you out on the day of, because it is roughly a 6 to 8 hour procedure for most people, and that is a long thing to endure. I do want to bring in an industry expert to explain the anesthesia process around hair transplants and alternatives if you are opposed to going under, which is, I think, a reason a lot of people choose not to have a hair transplant in the first place. I'm bringing in Dr. Gary Linkov. You probably know his videos from around YouTube. He's got over 1 million followers on this platform. Dr. Gary is a plastic surgeon in New York City, so let's bring him in.
When it comes to anesthesia for hair transplants, everyone gets at least local anesthesia, which is usually performed with lidocaine or Marcaine. Not only does this help control your pain levels, but it also helps cut down on bleeding, because most of these anesthetics have epinephrine in them, and epinephrine helps clamp down on blood vessels and reduce blood loss. Sometimes, for added patient comfort, oral sedation or general anesthesia can be added to improve your experience and make this process as tolerable as possible. Oral sedation can include medications like Valium and Ambien, for example. General anesthesia for a hair transplant is more rare because of the risks associated with general anesthesia and because of the length of a hair transplant. These surgeries can take 8 to 12 hours sometimes. So if you're under general anesthesia for so long for an elective cosmetic surgery, it might not be the safest thing for your overall health.
So I did the general anesthesia and I did the local one. And I would say the local one is the only thing that really hurt in the entire process. I'll get into this a little more in the video, but I don't think of hair transplants as painful. I just think of them as a really awkward process. And the only real pain I remember occurring is while the general anesthesia was going through me, they were doing the local anesthesia up top. Just those initial pricks around the scalp that they were doing to numb the scalp a little more is really the only pain I felt during the procedure. I was in and out a little bit. You're never really like fully under. You're usually able to be like brought back if they need you for anything, or maybe you've got to pee or something. But sometimes that local anesthesia wears off and you might feel like a random prick again, and you just say, hey, I felt that one. And then they, give you another little shot, and then the area is numb again, and then you doze off and they continue implanting the hairs. It's weird. Again, you'll hear me say that word and awkward over and over in this video. Yeah, and you probably will doze off, which is weird that they're like poking all these needles into your head and you're just taking naps left and right. But what's great about it is, I think my procedure was around 6 hours. My partner's was around 8. I think I only remember mine being about a 2-hour experience, and he said about the same thing, maybe 2 or 3 hours. So it's really kind of nice that you just doze in and out, but you're never fully out. They could wake you up anytime they want to. It's all totally up to you. It's all a conversation for you and your doctor, all right? So let's talk about the extraction process. They are obviously taking hairs from the back and maybe the sides of your head. These are the places where your hairs are not going to naturally be falling out in the first place, because when you lose your hair to male pattern alopecia, you are losing it from the top of your head. If you are a candidate who needs a lot more hairs moved around, they might be taking it from chest hairs, pubic hairs, anywhere on your body. The neck is a really, really common place to be taking hairs from. That's a conversation for you and that doctor. The extraction process I'm outlining here pertains to the FUE and the DHI methods of hair transplantation. They do not refer to the FUT method, which is where they take a strip of skin from the back of your scalp and then use those hairs separately. They're going to take things in a very uniform and clean way from around the backs and the side of your head, so that when everything heals and the other hairs that remain there grow out, it still looks as natural as possible. During the extraction, as they're pulling these hairs out, those grafts are then going to another team who is looking at each graft under a microscope, and they are seeing how many hairs are growing out of each graft. So it's likely between 1 and 4. Some people might get as many as 5 hairs, and they're sorting all those hairs. So here's all your 1s, here's all your 2s, here's all your 3s, here's all your 4s. They do this kind of twofold. One is so that they can evenly distribute those hairs once they implant them up top of your head, just so that they get a good distribution of 4s and 2s, and not accidentally placing all the 4s in one place and all the 1s in another. But probably the most important thing is the entry of your hairline is going to have lots of 1s, maybe some 2s, and that's going to give you this really soft hairline instead of like a really hard to find one that's like a wall of 4s and 3s and 5s. So they are sorting that for that aesthetic reason. This extraction process takes a couple hours. It's the shorter of the two. The implantation process becomes a little more precise and slowed down. Most people will be extracting somewhere between 2,000 and 3,000 grafts. They'll probably max out at about 3,500 grafts in a single session. Some of you might be getting less than 2,000. Maybe you're just filling in some widow's peaks or something like that. However, you can probably expect that this extraction to be 2.5, 3 hours at most, and then the implantation process sort of scaling up from there, being anywhere from like 3 to 5 hours. That's all ballpark, truly ballpark. Okay, so the extraction process is done. Maybe you've got up, you've taken a pee or something, looked at your weird head, the current state of it. Don't worry, things are going to get a lot more weird. You're back in the chair. They've sorted all the grafts into their 1s, 2s, 3s, 4s, and 5s, and they're going to start implanting. Now, if they are using the typical FUE and DHI method that is common these days, they're going to make individual incisions for each of those hairs, for each of those grafts rather, that house 1 to 5 hairs each. And they're going to implant them at the natural angle that those hairs should be growing. This could differ depending on if it's at the hairline or if it's around the crown. I'm not going to get into the exact specifics of the angulation here. The doctor will know what they're doing if they're experienced, if you've seen their good before and after photos. In some places it might be 20 degrees, in some places it might be more 30 or 40 degrees. I've heard a lot of things said, so I don't want to give hard numbers here because it can differ. Immediately after the procedure, they're going to bandage you up. You'll obviously be bloody up top and in back, but they're going to give you an extra padding, almost like a diaper, around the back and side of your head. They're clearly not going to bandage the top of your head because those follicles are very precious and volatile. They are going to give you the appropriate painkillers, antibiotics, and anti-inflammatories just to prevent things from swelling up or you from feeling anything really. And that's all a blessing. The diaper type bandage is really going to allow you to like lean against a pillow for, you know, at the 45-degree angle for that first night without having to worry about any blood getting anywhere. There's a good chance they're also going to give you an anti-swelling band to put around the top of your head, almost like you're in the NBA or something. And this is obviously going to keep the swelling localized up here instead of falling down your face. Yeah, I made the mistake of falling asleep horizontally, and I did not have an anti-swelling band when I did my hair transplant because I had some hairs transplanted like on the sides of my temples here, so I couldn't wear the band. And I made the mistake of being so exhausted when I got home that I failed to put myself at an angle. And you do not want that swelling to fall down your face. Here's a quick flash of what that looks like. I'll get into that more in my other video. That's fully myself to blame there. That is no clinic's problem, nothing. You need to do everything you can to prevent swelling. Look, I might be a journalist, but a lot of my stuff is learned by mistake, and I always say do as I say and not as I do. They will remove this bandaging the day after your hair transplant. So I will say if you have traveled for the procedure, whether that's one state over or around the world, you do not want to fly the morning after your procedure. You do want to do the control at the clinic where they remove the bandaging. They're going to give you some more topical medicines. They're going to wash the site very gently. They'll make sure everything looks good. You are free to fly that night if you need to. You can stick around another day or two. I stuck around Istanbul 3 days after my procedure. With my partner, we flew home the night after his procedure. I much preferred that. Granted, we were living in Germany at the time, so it was just a few hours flight. It was very easy to get home. It might be different if you're flying halfway around the world, but what I will say is that in the Istanbul airport and all around Istanbul, you will see tons of people who have just had a hair transplant. If you want to stay an extra day or two, fine, do it, but you're not going to look any less weird or have any easier time getting home if you wait another few days. I would just say get home sooner than later so you can enjoy the recovery from the comfort of your home. But again, no sooner than the night after your hair transplant. You do want to go to the clinic and give plenty of time the next morning. Now we'll jump into the recovery timeline in a second, but first I do want to talk about the sponsor of this video. I alluded to it earlier. It is Feel Confident, a skin and hair care brand from the one and only Dr. Gary Linkov, plastic surgeon, hair transplant surgeon in New York City. With Feel Confident, you have low-cost access to prescription medications that will help you regrow your hair. You've also got a trio of hair thickening products, a shampoo, conditioner, and foam. You've got the essential skincare products like a gentle cleanser and moisturizer, as well as a hydrating serum, and even a scar gel if you need it. I think this brand is really aptly named. You can feel confident in such a streamlined, high-performing, simple skincare routine, as well as hair care products that will help you maximize the density of the hair you currently have, as well as these low-cost prescriptions that help you regrow or retain the hair so you have the fullest expression of hair for as long as possible. Thus, you'll be feeling more confident. You can use this code for 10% off your first order. It does not apply for the prescription hair loss products. Thank you, Dr. Gary. Thank you, Feel Confident, for being one of the very first sponsors of Blueprint and our YouTube content. Now, let's talk about the recovery timeline. We can look at it in a couple ways. First, what is the physical recovery you're going to endure over the next couple weeks up to a month? I think that's the most important timeline to consider in terms of you getting back on your feet and living a normal life. Secondly, what's the timeline for growing your hair back? When are you going to see the results of this actual hair transplant? Let's start with the short-term physical recovery. Again, I always frame this as a month-long process because all the weird, awkward stuff really happens in that first 30, maybe first 40 days. In terms of feeling normal, going back to work, you'll be able to do this right away. Some people do it the very next day, some people wait a few days. I would encourage waiting maybe 3 or 4 days just to let your body physically recover from everything. However, you will be able to join those Zoom calls. In theory, you could go back to the office. Maybe you didn't fully shave your head and you're a little more discreet about things. You will be able to participate as much as you need to, as much as you want to, relatively quickly. But it is paramount to be as careful as possible with all the hairs on top of your head. So you really need to avoid taking showers with hot water. That includes high water pressure. That really includes all sorts of water pressure. You almost want the shower to be hitting you from the shoulders down, and then you can sort of gently shampoo and wash your face separate from all that. You need to be sleeping at an angle for a few weeks. You need to avoid wearing any hats. You need to avoid direct sunlight. You have to avoid any intense sweating. You obviously should not be having sex for a few weeks. Every clinic will give you a different timeline for all these things. Typically, they'll range from 15 to 30 days. I sort of say aim for 30 days on all fronts if you can. You want as many hairs surviving as possible. So if you can just build a habit around being very gentle, not putting a lot of stress in that area, then you are in the best situation as possible. Some clinics will just say 15 days is because there's a lot of scabbing that occurs immediately after the process. So within a couple of days, everything's gonna scab over. In fact, in my case, it was almost like I had an entire helmet of a scab all over the transplanted areas. It was so weird. So this scabbing does start to fall out itself after about 10 days. And so after that point, in theory, you know, those hairs are probably planted. The wounds have sealed up. Some of the hairs are going to come out with the scabs. That's normal. You're going to be losing those hairs anyway. I'm going to get into that in a second. And by this point, you're probably in the clear over the hairs that have survived and the hairs that have not. So this is why a lot of clinics really draw the line at 15 days versus 30 days. Again, I say if you can, just go for the full 30, take it easy, avoid sun, avoid heat, avoid pressure, avoid sweating, all those things up there. You obviously want to avoid things like smoking and drinking. You should be sleeping really well, staying hydrated, eating a healthy diet. Do as much as you can just to stay balanced in this window of time. So as for that timeline of hair growth, you've had the scabbing over, and maybe from the first week to the second week, that's when the scabs are gonna start coming out. Again, don't be alarmed when you see some hairs in the scabs as they come out. You'll be losing scabs everywhere. They'll be on your pillow, from the back of your head. You might be peeling. Don't hasten any of the peeling up top, but you'll know when they're ready to come out. They will be basically freeing themselves, and you might wiggle them free. They might be hanging on to a couple extra hairs. The general survival rate of the hairs in this area is 90%. So yeah, you aren't going to keep all of the grafts that have been implanted, unfortunately, but as long as you're being especially careful in these few weeks, and as you're letting the scabs heal and fall out naturally, you should be as good to go as possible. There is a really sweet spot that I remember this week very fondly, when all the scabs come out and there's still enough hairs in the transplanted area, and all the hairs that they shaved that are your natural ones from the top of your head, they've grown out a little bit too, because it's like 2 weeks of growth, right? So it's like a couple millimeters of growth. And you have this moment in time where you can see what your hair would look like if you had a really short buzz cut, and you get a glimpse at that fullness, and you just it's like savor that moment, because you're not going to have it for about 6 more months, but it's a reminder of why you did this. And it really feels nice for a couple days just to walk around town. You've got no more scabs, but you've got as much hair as possible. You're going to feel great. But then it abruptly ends, because all those hairs will continue to fall out. Now, this is something called shock loss. All those hairs that have been moved around, the vast majority of them are going to fall out by day 30, maybe 35, and you'll be left with the hairline or the hair density that you started with. And if you have really short buzzed hair, you kind of also have a glimpse of what things would look like if you had never gotten a hair transplant. And within 3 or 4 months, some of them will be expressing themselves, And then within another couple months, typically 6 or 7, is when you could probably cleanly do a buzz cut again and see the full expression of hair as it is going to be for the rest of your life, assuming you keep doing the hair loss drugs that we've talked about in other videos. So day 15, scabs are out, you have a nice expression of hair. Day 30, you have probably lost all the hair again. You're back to square one. You can resume your life. You can resume everything normal. And then you've got a couple months to wait before they start popping up. And you got a couple more months to wait before you can really show it off. And it keeps getting better, because up until about month 18, you are going to keep getting thicker and fuller hair. The results just keep getting better throughout this whole process. It's just a lot of weirdness on the way there. Speaking of weirdness, for me, somewhere around day 35, for about a week, things were itchy, like insanely itchy. Not painful, just annoying. Just, I have like goosebumps thinking about it. Also, there is going to be a lot of inflammation and redness around the entire area. Remember, you just had thousands of little micro wounds all over your head. For me, that inflammation and redness, it still lasted into like month 2. So even though I had my full, my hairs had all fallen out that had been transplanted and I was left just with my original hair pattern, I could see a lot of the red inflammation there. That all subsided too. So I don't want you to be too worried about just the long standing nature of inflammation. It is something you could have checked up on after a few months if you're worried if it's still there. But for me, it lasted probably around 60 or 70 days. For my partner, much less, definitely like half that time. So that inflammation, that redness might differ from one person to the next. Don't be too alarmed, okay? Now, as for the ongoing upkeep, I cannot stress this enough. I've said it in all these videos, but you need to keep doing hair loss medicines and treatments to keep your hair, because the hairs that you've rearranged and put up top of your head, they are going to stay planted, but the hairs that are native to the top of your head are still susceptible to the male pattern alopecia. If you are in your early 20s and watching this now, hey, why don't you start some of these things now? You might never even worry about hair loss. You might never get to the point of worrying about a hair transplant because you are taking the measures to keep your hair as thick as possible. Now, there is one note I have about the length you can wear your hair after a hair transplant. This will be different for every single person based on the current density they have, how much hair they had transplanted, certain hair patterns, and whatnot. But in my case, I have a lot of hairs here, almost like a horseshoe that is covering the recessed hairline that I was dealing with. And I had 2 bald spots from vitiligo that were largely filled in. So those are much denser than the rest of my hair in general. So anyone who's looking at me eye level sees fullness, but if I were to shave my head down to a really thin amount, you would see that this is a little fuller and the 2 bald spots are a little fuller than everything else. So in my case, I would probably never shave my head that short. But if I went to like a centimeter's length, you would never notice the difference. It's thick enough, it's dense enough, it's easy to densify and to texturize with hair products. I never would have shaved my head that short anyway when I had the recession and the thinning. But my limitation is I have to always have hair that's roughly a centimeter or longer if I don't want anybody to notice. The only people that have ever really noticed are my barbers. Some of them don't notice until I say something. When I was living in Berlin and I had a Turkish barber, he called it out the second he saw it because he probably has seen a lot of them. But he also said that he thought I had the best one that he's ever seen. Let's wrap things up here. I do want to summarize this entire process and just remind you that although it is extremely awkward, it is also extremely rewarding. I feel so grateful every day about my hair transplant. I speak for my partner as well. I do think it's worth $4,000 or $5,000 if you can afford that to get all the way to Mexico or Turkey or something. I probably would have questioned it if I had to pay $40,000 or $50,000 in a big city. That is a decision that some people are able to make, some people are not able to make. It is totally up to you, but do your research, don't cut corners. Please make sure you go to a clinic that has fantastic before and after results, fantastic reviews, that deals with your situation specifically and uniquely, that you feel cared for by them. I would say watch the other video I put up that does have some red flags to look for when you are deciding on a clinic. Phew, that's it for this video. Thank you for following along all this while. Please, if you like this video, prove it with a thumbs up, prove it by subscribing to the Blueprint channel. do us one more and subscribe to the Blueprint newsletter. I send out a newsletter every week just talking about all things grooming related, not just about hair loss. I talk about fragrances, I talk about the best new products, I talk to industry experts, I help debunk certain ingredients, what's worth your money, what's not. We do some exclusive product giveaways. You can do that at grooming.tips or at the link below this video. And hey, why not comment below if you've had a hair transplant, if you're thinking about one. What's your experience? What's your concern? Maybe some things I said in this video differ from the experience you've had. I'll see you in the next video. Soon I'll even be publishing one about my personal experience with hair transplants and my partners, so watch out for that.